Henrietta Schaefer. I'm from Hayward, California. I turned 50 last year and I have this constant stomach pain for a couple of years now, and my doctor would always give me antibiotic. Well, on the day of my birthday, the very next day I was in emergency at Eden Hospital, and they found out I have a little tumor in my pancreas. So they asked me to see a specialist. So I went and see. The tumor was only 3 milliliter. And by the time I saw the doctor, it was growing. So he said, benign or not, we need to take it out. And pancreas is a very sensitive part of your body because everything's hooked to it. Your liver, your stomach, and your intestine. Basically, if you have a pancreatic cancer, there is no treatment. So anyways, in a month, it grew to a quarter size. So they did this Whipple surgery is what they call it. Basically, they cut part of your stomach, detach your liver and your intestine, and then they take part of the pancreas, which is the head, because you have the head, the body, and the tail. And what happens after that, though, is the ability to eat, because they tighten your stomach, and so it's like having those bypass where people want to lose weight. So the first 2 months, I would throw up everything I eat because, first of all, I didn't learn how to eat proportion, and I didn't learn how to eat slow. So basically, kind of like makes you eat very little, like 6 times a day. I was in the hospital for 12 days, though. It's very painful. It's a major surgery. And one thing I learned, though, if you have any pain in the stomach and it's gone for a couple of years, you should see a gastroenterologist and insist on something, because the pancreas is something you can't see. You know, you can't see anything. And if the tumor they try to take the tumor by itself without cutting your pancreas, because the side effect of getting a smaller pancreas is diabetes. Because your pancreas produces those enzymes that helps your liver, your stomach, and intestine to digest these things. So without your pancreas, it's kind of dangerous. So that's one thing you need to watch out for is diabetes. And make sure your stomach has a motility, because that's what I'm running into right now. It was just, I found out November, December, it grew in December, in January I had surgery, and now I'm still seeing a doctor because I lost the motility, which is the movement of your stomach. So it's hard for me to eat. So what they did, they enlarged my stomach a little bit and gave me medication, and from there we see it. But those are the side effects, and a lot of not being able to eat and pain in your stomach, because those pain won't go away with your painkillers. So watch out when you have stomach pain. It's not a joke, because in the stomach is all those sensitive parts of our body. That's it. I hope this helped.